Hello. In this video, I'll answer frequently asked questions about the medication Pamelor, which contains the active ingredient Nortriptyline. If you find this video helpful, please consider subscribing to support my channel. What is Pamelor and what is it used for? Pamelor contains Nortriptyline, a tricyclic antidepressant, TCA, used to treat symptoms of depression. In addition to treating depression, it may be prescribed for other psychiatric conditions as determined by a doctor. Dosage and how to use it. Forms and dosages. Pamelor is available in 10 mg, 25 mg, 50 mg, and 75 mg oral capsules, and a 10 mg 5 ml oral solution. Dosage instructions. Typically taken once or twice a day, as directed by your doctor. Dosage is personalized for each individual. When to take. Pamelor can be taken with or without food, but it is best to follow your doctor's specific instructions regarding timing and whether to take it with meals. Important precautions. Interaction with MAO inhibitors. Do not take Pamelor if you have used an MAO inhibitor in the past 14 days. Examples of MAO inhibitors include isocarboxazid, phenelzine, and tranylcypromine. Alcohol interaction. Drinking alcohol can lead to dangerous side effects and should be avoided. Driving and operating machinery. This medication may cause drowsiness, so avoid driving or tasks requiring alertness. Sun sensitivity. You may be more prone to sunburn. Use sunscreen SPF 30 or higher, wear protective clothing, and avoid tanning beds. Interaction with other medications. Using opioids, sleep medications, muscle relaxants, or anti-anxiety medications may increase drowsiness when taken with Pamelor. Pregnancy and breastfeeding. Consult your doctor if you are pregnant or breastfeeding, as special considerations are needed for using Pamelor during these times. Side effects. Common side effects: dry mouth, nausea, vomiting, loss of appetite, blurred vision, breast swelling in both males and females, numbness or tingling in hands or feet. Side effects requiring emergency attention. Signs of an allergic reaction: hives, difficulty breathing, swelling of the face, lips, and increased blood pressure. Effects on mental health. Antidepressants can sometimes lead to suicidal thoughts, especially in young people. Regular doctor checkups are important. If you found this video helpful, please like the video and subscribe to the channel to support us. Feel free to share your thoughts and experiences with this medication in the comments section below.